Welcome back to TV5 News at 9. The Covenant Kids Radiothon is taking place this Thursday, April 10th on 102.5 WIOG. Listen to life-changing stories from patients and staff at Covenant Children's Hospital. You can also call or text to donate during the Radiothon on Thursday or by using the QR code on your screen. Every penny donated will stay local and go directly to supporting and enhancing programs and equipment to support care for babies and kids in our region. Today we have a guest who's part of that amazing team providing care and resources to kids and families across the community. Please welcome Bregan DeFazio, a nurse from the Pediatric Intensive Care Unit. Thanks for joining us.
Yes, thank you for having me.
So Bregan, you work with the team at Covenant Children's Hospital. Tell me a little bit about what you do.
Sure, yeah, so I work as the clinical outcomes nurse specialist for pediatrics in the Pediatric Intensive Care Unit. And part of my role, I work to ensure that our practices at the hospital align with the latest evidence-based research that's outlined in the literature. And so I work really closely with my team to make sure that we bring in those practices from the literature into our hospital's policies and protocols.
Awesome. And Covenant has a lot of unique services for children that aren't part of all hospitals.
Yep.
Tell me a little bit about the Covenant Pediatric Unit and the Pediatric Intensive Care Unit.
Sure. So we have a 24-bed pediatric unit, and 10 of those beds have intensive care monitoring capabilities. So we have a board-certified pediatric intensivist that is on call 24/7 and can provide expert care when it's needed. All of our inpatient nursing staff, our respiratory therapists, and our physicians receive advanced training in pediatric life support. So they really are highly equipped and qualified to care for sick and injured children. But not only do we have those individuals, we also have a dedicated social worker that works directly with our patient population. We have pharmacy, we have a dietitian, and speech and occupational therapy, all of whom are trained specifically to care for children. And then we also have access to pediatric subspecialties, which is really nice. Some of those include pediatric surgery. There's cardiology, neurology, child and adolescent psychiatry, and it's really nice to be able to offer those subspecialties because it means we get to keep the kids local for their care.
And not all children's hospitals in the region have that kind of support.
That's right. That's right. Yep. So we are very lucky and to be able to offer those services.
Definitely. What are some of the conditions the team in the pediatric unit specifically help with? Yeah,
so we really do see a wide variety of different diagnoses. We're kind of just ramping up the respiratory season, so we do see a lot of kids that come in with respiratory issues such as flu and RSV. We see kids come in with complications from diabetes, asthma exacerbations, seizures, traumas. There's really a little bit of everything that we see.
And Covenant is also a verified level 2 trauma center for both adults and kids. Can you tell us more about the Pediatric Emergency Care Center?
Absolutely, yeah. So having that verification as a level 2 trauma center means that Covenant has the capability to care for your entire family in the event of an emergency, no matter what their age is. And our emergency department cares for hundreds of kids each day and thousands each year. So we really understand that children are not just little adults when it comes to health care. They have unique medical needs and require close attention. And so part of that and part of being a children's hospital is having the appropriate medications, supplies, and equipment for all ages. And not only that, but it's having the staff that are confident and comfortable for caring for these kids. You know, you need to be able to have an effective conversation with a child and make sure that you explain things in a way that's easy for them to understand.
Right.
You know, oftentimes emergency departments, just by nature, are very fast-paced, and it can be very overwhelming for an adult, let alone a child. So anything that we can do to make the child seem more comfortable. Our emergency care department has a space designed specifically to kind of alleviate stress and anxiety when a child comes in. So there's bright and there's vibrant colors on the walls. There's pictures of animals and other kids, all things that resonate with kids and make them seem a little bit more comfortable in the space.
And that's so important too, making them feel comfortable.
Yep, yeah.
Well, Bregan, I want to know, why are you so passionate about the work you do and the teams you're
Yeah, thank you
care
for
for.
asking. You know, I truly believe that caring for a child goes beyond just treating the illness or the injury. You know, you have to provide care in a way that a child feels like they are understood and they are heard and they feel involved in their care. You know, you want to be able to support them through the healing phase. And what excites me is working with a team of healthcare providers who share that same vision. You know, children are our future, and it's really fulfilling to be able to provide care today that we know is going to lead to happier and healthier lives for tomorrow.
Well, thank you so much for being here and giving us more insight into what Covenant Kids does. We appreciate you.
Yeah, thank you so much for having me.
And once again, remember, you can hear more from patients and families on the 7th annual Covenant Kids Radiothon Thursday, April 10th on 102.5 WIOG. Just call or text to donate during the Radiothon on Thursday or use the QR code on your screen today. Every penny donated will stay local and go directly to supporting and enhancing programs and equipment that care for our babies and kids in our region. You can find more information as well if you just visit the hot link section on our website, WNEM.com.